Hello, everyone. Welcome to our event today. I'm Michael Pagel, the Program Manager of Greening Healthcare. And this webinar topic today is from COVID to climate crisis, getting back to savings. As it might seem intuitive from that, as things continue to kind of trend towards the end of COVID in terms of an immediate crisis, and hopefully keep our fingers crossed, we need to get back to a stronger focus on the climate crisis. So today we're looking at operational and low cost measures, which will result in big savings potentially, and otherwise known as the low hanging fruit. It's been a while since we revisited a lot of these topics, so we're going to look at them today. For housekeeping, you can use the Q&A button with any questions for us, and webinar recordings will be posted later this week. And for our program, we are pleased to partner with CHES again this year. And also a big thank you to our program sponsors for their support: Enbridge Gas, Thermogenic Boilers, and Save on Energy, delivered by the IESO. And thanks also to JCI Johnson Controls for sponsoring this event. And finally, I'd like to just give a warm welcome to our newest member. Shared Health Manitoba, including the Winnipeg Health Sciences Centre, are joining us for this year. So we're happy to have them here. And Greening Healthcare is run under the nonprofit organization of the Climate Challenge Network. And I'll just go through the agenda here, Ian. We'll start off with the welcome into context. It's our first webinar of the year, so we're going to look at our goals in the program for this year. And then we're going to get into the energy results for 2021. Those are the savings made, the top performing hospitals, and what the biggest areas of energy savings opportunities, also known as energy components, which we focus on a lot in this program. Then we'll get into the new low-hanging fruit, bringing the low-hanging fruit back, I guess, finding the low-cost operational controls and maintenance measures to drive the biggest savings, including a new checklist, which is focusing on recommissioning. And then for the last half of the program today, we're going to be going to a panel discussion. We have 2 member hospitals, an industry expert, and our moderators for getting the most out of your BAS. And then we'll look forward to our events for the year and what's to come. And now your host is Ian Jarvis, the Executive Director of the Climate Challenge Network.
Thanks, Michael, and good morning, good afternoon, or good evening, everybody, depending on where you're calling in from. And we begin, as always, all Climate Challenge Network events begin with the acknowledgement of our responsibility to the planet and our kinship with all peoples of the world. And in particular, from where we're presenting this webinar from, we acknowledge the ancestral and unceded territory of the Inuit, the Métis, and the First Nations people with whom we share these lands. I acknowledge I'm speaking to you today from the traditional land of the Huron-Wendat, the Haudenosaunee, the Anishinaabe, and the Mississaugas of the Credit River. So let's go across, as Michael suggested, in the agenda to the welcome, and it's welcome to all of you. I think at last count we had 137 people registered for today's event, so we've got a lot to say, and we love to have more people. The more people, the better there to hear from us. So. But let me, for anybody who's new to the program or may have forgotten, the greening healthcare is kind of 3 elements that we see going backwards and forwards. Coming out of today's event, we expect you to be informed. We expect you to have new knowledge. So information that allows you to move down the pathways that we're sharing, which is around energy efficiency, utility cost savings, and emissions reductions. And we look to bring people to the table that can also inspire. So everybody on this call already has 110% of a job that they're working to do right now. Everybody's busy. And how do you find headspace and bandwidth to deal with the climate crisis, to deal with emissions reductions in the middle of all the day-to-day things that you absolutely have to do? So we try to provide some inspiration with good external speakers that can help bump the priority 1 level up. But information and inspiration you can find elsewhere. This is all about action. And we're looking to provide you with knowledge that you can take away tomorrow and work with and do differently than you would have done otherwise. So if it's not about action, if you leave these events, even if you've been impressed, even if you've been inspired, if you haven't found things you need to do to take action to improve the energy and emissions profile of your space of work, then we need to hear back from you, because we're missing the mark. We take seriously our responsibility to get this right, to help you take action. We're conscious of how busy you are. And again, if we're not providing adequate and proper support, then we're not getting our job done, and we need to know about it. So that's what Greening Healthcare in a kind of capsule is all about. Our welcome, let's extend that to our member hospitals. Thank you for being here. We're going to show you how you did last year, because we're, as you know, tracking your numbers. We just recently sent out the latest, the fourth quarter savings reports for 2021, and we'll show you what that looks like. And I think it's both disappointing and motivational in terms of how the savings performance worked out during 2021. And the important thing, again, is respect for everybody out there is busy. You're all working, doing the right things. And we need to be supporting your goals, your priorities, and setting realistic timelines for things to get done there. That's our piece of the bargain that we have with all of our member hospitals. For the non-member hospitals, there are 37 of you registered today, and a very simple message across North America is join us. The Greening Healthcare is all about the power of the network effect. Everybody knows about the social network and Facebook, and the power of numbers within Facebook and with social media has shown us that in spades. And when you double the membership of Facebook, you quadruple the power of the program, because there's just more information being shared by more people, more dynamics. We believe very strongly that the network effect is one of the solutions that is going to come to the rescue of the climate crisis. And within the healthcare sectors, frankly, we are looking for and doing whatever we can to bring more hospitals into the fold, because the network effect says when we double membership, we quadruple our impact. That's very simple. So we know a number of folks on the line today have been calling in, looking in, kicking the tires, getting to understand what Greening Healthcare is all about. We really hope you found some information and inspiration that was useful, but to get to the action stage, you need to become part of the program. So please do consider this year being the year that you join the fold and become part of the action. With industry, there are 40 different corporations represented on the call today, and work with us. And many of you we're talking to directly about cohort projects coming up and areas of common interest and areas that we know that you care about, which is you have sustainability policies, you have commitments to the green agenda. All of those things are in play right now. Again, the invitation is join us, work with us. Let's kind of help shape this new green economy that 20 years from now we'll look back and say to you, do you remember back in 2021 the way things were? And we'll shake our heads in disbelief because the world is changing. We need to change with it. And we believe that the industries that are best able to adapt will be the ones that will prosper in the years to come. And finally, welcome to our government partners, associates, people who are involved, the utility companies, to the colleges and universities that are becoming increasingly involved with us here. We know that when we properly align policy with programming, with research focus, using the kind of evidence-based, the data-driven metrics that are coming out of Greening Healthcare, we actually make real solid progress in moving forward with this vitally important agenda. So welcome to all of you, and open invitation. We need help. That's a big tent here. We've got, as I've said to many of you recently, we have ambitions to help around climate change that are way beyond our means. It's a big tent. We need everybody on board to help move this agenda forward. So welcome everybody. Let's take a look at where we're going with 2021 and the 2022 goals that are coming forward. So our goals for the coming year. Climate Challenge Network across a number of different building sectors. So we recently beginning a program in post-secondary, working with Ontario colleges and some colleges and universities in Alberta to move forward on that front. But we work with municipalities, we work with K-12 school boards and greening healthcare. And it's one simple mandate to, we know how very large the emissions reduction potential is within these buildings, and we need to get on with it. We need to accelerate progress. We're just not getting fast enough. We're not getting far enough, fast enough, and we're running out of time. But those 2030, 2040, and 2050 goals that are being set across the world, they're real. Every year we're a year closer. We need to get on with that. So we're all about accelerating progress, and we need your help. We can only provide the information and the inspiration to guide action, and we need to help you take action. We want to be clear to everybody that this is all built around what you need, what's in your goals, what are your priorities. So we listen carefully to you. We heard from North York General last year about their sustainability targets within their strategic plan and the impact that was having from their board of directors. But you've all got energy efficiency goals, you've got climate goals, everybody needs to reduce utility costs. And increasingly, our world is within the space of capital planning and asset management. And we can't get to the low carbon future without making better capital choices today and tomorrow and next week and next year. So this whole area that we'll touch on more later in the year around the new hospital performance, this whole area of hospital redevelopment and making low carbon choices now that will live with us for the next 30 years is a big deal. So we're conscious of your goals. Michael is in conversation with almost all of you almost all the time. Keep giving us the feedback so we can align our program with where your heads are at right now. I've touched on this already, and it won't be the last time today. Growth means everything to us. So Heather Bell, our new Director of Programs and Partnerships, is on the call today. She's been in touch with a number of you already and will be there. Growth drives the network effect. The network effect is what we need to exponentially grow emissions reductions. So that is our primary goal for this year. We need more people in tent. And for you, it's teasing through all the noise, all the things you could be doing, all the things you know about, all the things that people are knocking on your door and saying, have you looked at this? Our work, our responsibility to you is to tease out from those, what are the things that really make the big difference? And what help do you need to move them forward? And I'm particularly delighted with our technical panel today of folks who, frankly, are just as busy as everybody else on this call, who are taking the time out to work with us both in advance of this meeting and at this meeting to share their insights and their ideas and their thoughts about what do we need to be able to move this agenda forward as quickly as possible. Everybody should by now have received, and if they haven't, please we'll give you the contact information at the end. Let us know. We've fully updated the Greening Healthcare Program overview. It's an easy 4-page read, and it has 3 main sections. The first one is recognizing successes. So measuring savings against 5 years ago, 2016 and 2021, we had some quite remarkable results. And back in December at the annual forum, we recognized the 5 hospitals and gave you a little bit of a case study and an overview of those 5 hospitals as to what they'd done to achieve greater than 20% savings, with the knowledge that 75% of our hospitals had that level of savings potential. And we learn from the ones who've put it in place to help the ones who are still working towards achieving those kind of reductions. But we were happy in 1 year to see close to $5 million of utility cost savings. That matters. That's what makes the business case for you to take your time, as well as spend your membership dollars to be part of this. And we're pretty happy with 13,400 tons of emissions reductions. That's getting into being meaningful kind of numbers. So 2021 compared to 5 years earlier was good. We'll show you in a moment what it looked like compared to 2020. But recognizing successes, this is what drives us. This is what motivates us. We also present within there a much more fulsome description of what happened in 2021 with the program. We regard it as certainly the fullest, the busiest program that we've ever had in the course of a year. During 2021, we had 3 technical webinars which covered a range of subjects, but the primary ones were looking for a second time at how well LED lighting conversions are happening, and I'll come back to that later in the program. We looked hard at OR ventilation best practices and setbacks and controls and monitoring for safety, as well as for energy efficiency. We began a series of webinars that will continue this year around ventilation resilience. There's nothing good to say about COVID, except perhaps that it's taught us a few things about the importance of air handling systems of ventilation within buildings, and that need to balance indoor health and comfort and safety with the realities of the climate crisis, which is we don't have an infinite budget of thermal energy sources, of carbon energy sources to use to work that. So this refocusing on ventilation systems we think is fundamentally important. It's a theme that's just going to keep on going for the next 2 or 3 years. Kind of heads up right now, I'm kind of warning you. So, the fourth area that was, again, a central theme for last year was once again releasing the 2021 report on the performance of Ontario's new public-private partnership hospitals, the P3 hospitals, and the ranking of those, and in particular, watching their progress from year to year since they opened, and extracting from that performance the lessons learned that everybody can be folding into new and both new and existing hospitals on a go-forward basis. So that October 6th, I think it was, webinar on the P3 hospitals, and in terms of anticipation for 2022, that work is now, since we've also published the case study on the Humber River Hospital that I hope everybody received. Again, if you didn't, that is both object lesson in the how, like how did something as exceptional as Humber River, which we now rank #2 in terms of energy efficiency in the world, how did that come about from Bob Collins' amazing vision and tenacity, and despite the odds, making it work all the way down to the technical systems level. So we've got lessons for designers in that. So it really is this, the soup to nuts of looking at how does exceptionality take place. And when you're reading that, it shouldn't be, wow, look what Humber River did. It should be that everybody over the course of the next 10 to 20 years has to become exceptional. There's no plan B. We got to get to these low emissions levels that are practical through retrofit and redevelopment and smart operations to get to the space. So the technical webinars last year were strong, and you'll see a similar kind of program that I'll show you at the end. And the 2 forums are where the inspiration comes in. We had, in my view, exceptional keynotes, exceptional executive panels taking place over the course of last year, from the chair of Vancouver Coastal Health, sharing her vision of how that world was unfolding, to Bob Collins' comments in the annual forum in December around how did Humber River actually happen. So the forums, and I'll give you the timing of the 2 forums happening this year. Those are intended to be in-person events because, frankly, I miss you guys, and we want to rub shoulders again and share a glass of wine and do all those things back, if you can still remember back that far. But we'll get back to a bit of normal. But all of this is, the forums are intended to be inspirational, forward-looking. Where's the world going? How do we fit in? Where does the healthcare sector progress? And again, we found exceptional speakers to certainly inspire me, and I hope inspire many of the people on this call, around the low carbon future, around the practicalities of how do we transition from steam-centric high carbon plants to electrification and low carbon plants over time. Again, the reference to the Humber River case study and the beginnings of work that we'll be presenting in September this year around benchmarking the world. What are the most efficient hospitals around the world? What sets them apart? And what can you be doing to emulate the kind of practices that they have? And this work is engaging governments, designers, planners. You may know that in the UK, the government has legislated the fact that the 30 new hospitals they have on the drawing boards have to be net zero. And just like the rest of us, nobody knows how to do that yet, but we got to well figure it out, and we got to figure it out quickly. But those kind of commitments are there. So the webinars, the forums, and the industry engagement, we with Heather's help have substantially increased our outreach to industry players, because once again, this is a big tent. We need your help. And it's not just funding to keep the nonprofit moving, it's the technical expertise, it's the knowledge you have, it's the practical roll up the sleeves, on the ground connection with real hospitals out there. That is what enriches the ideas that we can bring forward, makes them practical, makes them doable, and moves that agenda forward. So in terms of the program, this is what 2021 was for us. And again, from my standpoint, the richest program we've presented so far. And that same document, if you don't have it, please let Michael know and he will send it to you. It's an easy read, and I think it's quite an encouraging read. We lay out the plan for webinars and forums this year. The intention this year, as I mentioned at the end, is the summer forum will coordinate with the International Federation of Healthcare Engineers that have, I think at last count, 35 different countries coming together. It's in person. It's in Toronto this year, which is the magic opportunity. Let's get some of those big thinkers from elsewhere in the world. And our intention is to coordinate our summer forum with that event so that some of those folks will still be around and can share some broader perspective insights with us. And we've got a whole family of cohort and research projects that are getting underway that many of you have heard about. If you haven't, they're described, I think, quite adequately within this. And when you find ones that seem of interest to your hospital or your industry in your place at your time, let us know. And we're looking for help. We're looking for resources. We're looking for participants. So running through this family of measures, and again, I can talk a little bit at the end about who the participants are already, what the timelines are for some of these hospitals, and why we think they matter. These projects are filling in significant knowledge gaps out there, and when the knowledge gap is filled, it's amazing how everybody gets really smart and they can go ahead and replicate or build upon what's been learned, and that's the intention of Greening Healthcare. So we're all about events and we're all about projects, and we need everybody to get involved. So far, so good. Michael, is there any protests or questions arising so far?
Nothing yet, Ian.
Okay, so let's talk about 2021, and we'll start by giving you the good side of the picture, which I've already touched upon. So back at the annual forum in December of last year, we presented this picture, and this very simply is looking at total energy savings relative to, in this case, the 2016 baseline. And it matters that we're talking 2016 baseline, and I'll tell you why in a moment. Which are the hospitals that made energy savings since then, adjusting for weather differences, but not adjusting for COVID or longer operating hours or extra hours, so not adjusting for any of that. And we found that a somewhat encouraging and interesting picture. So the group at the top there, the hospitals that made net savings, so the ones that are to the right-hand side of the 0% number, those are captured right there with 5 of them that we've already referenced, achieving greater than 20% savings over a 5-year period. That is remarkable because the energy performance of hospitals left unattended, it creeps upwards. Everybody's getting busier, they're doing more things, equipment deteriorates, things get out of control. So left unattended, the trend line is upwards, it's not flat. The fact that you're able to achieve savings, and in some cases savings as big as 20%, that is a big deal. And you can see the summary of that on the electricity side, how many made positive savings, on the thermal side, how many made positive savings, on the water side, how many made positive savings. Our focus this year, frankly, we love celebrating and recognizing the hospitals at the top part of this group, the savers, and learning from them and documenting what they did and what makes them special. Our focus this year is going to be on the group below on the left-hand side of the 0 line there, that Again, left unattended, energy use goes up, and sometimes it goes up by a lot. And we've had enough conversations with most of you to know that these are unintended increases. They're not related to an expansion or a reconstruction project. And you'll see at the bottom, Michael has excluded from these sites that added cogeneration, combined heat and power, and others that are under major renovation programs like Mount Sinai. So we excluded those because that's kind of understandable. It doesn't help, but it's understandable. So these are business as usual type hospitals. And if you don't know who you are, you should, because you've got those quarterly reports coming into place. But this is the reality of the world. Every building sector that we're looking at is going in the same way. There's unexpected, unintended increases that are substantially offsetting the savings that are being made elsewhere. And we have to start dealing with those that are going up. We do it through our quarterly reporting, but going forward, we need to do it by stepping in and giving you a hand to the extent that you're able to accommodate us and that we're not interfering, excuse me, to both identify and address those increases and bring them about, because the simplest way that Greening Healthcare has to double our savings every year is to avoid the increases. If everybody else just keeps doing their thing, and then we make savings on top of that. So when we talk about exponential growth, it's a combination of getting more hospitals, achieving their potential, driving forward, and addressing the hospitals that are in difficulty that are going up, and giving them the resources and the connections that they need and the information and hopefully the inspiration they need to drive that forward. So that was the 2016 story, the plus and minus. It looks more acute here. So here is the skinny look. If we took the same 2021 year and compare it to the year previous, 2020, you see the numbers of hospitals with electricity and thermal energy and water that went up instead of down. Our only good news story there was on water consumption last year. And thanks to all of you who fixed the leaks and tracked down the issues, because those things happen all the time. But last year was our worst year on record for year-on-year energy savings. Every year I've delighted 5 years ago, 4 years ago, and 3 years ago in reporting that the annual savings compared to the prior year went up every year. Last year, the savings went down. And we look at the trends, and I'll share a little bit of that in just a moment. And some of it, of course, is you made adjustments because of COVID, but in our estimation, very little of it is due to operational changes made to hospitals or space additions to hospitals due to COVID. There's certainly the issue that people were distracted. Man, I don't know how everybody got through last year with the number of demands being placed on you and bad news every day and frontline stresses and pressures. But if last year we were distracted, as Michael said, to begin this whole thing, the climate crisis hasn't gone away. So we're back in that mix right now, and we lost a year, and that year we can't get it back. So we just, Greening Healthcare needs to redouble its efforts, and we need to engage more effectively with all of you to grab a hold of the opportunities there. And again, you all know what your savings potential is. Those annual reports are coming out soon. But driving on to seize the moment, address the climate crisis, and now we have a European crisis. But crises is the nature of humanity. They're not going to go away. And somewhere across all of that, we still have to deal with that looming deadline, the deadlines that we have to meet around the climate issue. So not a good year last year. Net cost increase. We're not happy about it. We're sure you're not happy about it. We need to do better to help you do better this year. Give you some examples of what that looks like. There's a good news story on the top here, Hospital A. And because we've already shared this with Andrew, I can say this is Bridgepoint. So Bridgepoint's been one of those less well-performing of the new P3 hospitals, and they've got the hang of this now. So you can see, for those of you not familiar with this, the blue dots are the actual monthly electricity consumption here and thermal energy use here, in this case, gas consumption. The red dots are the prior year baseline, and everything's weather normalized. So where you got the blue dot below the red dot, that's a good thing. And look at the gas savings improving over the course of the year. And we're going to track that with enthusiasm into 2022 and look at the electricity savings through the summer. So that tells us things about what they did with the systems. That's a big deal. So that's a good news story that despite the climate, despite COVID, despite everything else going on, the team there was able to seize the moment, look at the savings potential, and put in place the right measures that achieve results at the meter. Because if we don't see the results at the meter, in our view, they never happen. Here is a more negative story below it. This is typical of the profile of a hospital that went the other way. I'm not going to name this one because we always celebrate the ones that are doing well. We never name and shame anybody. That's not the way greening healthcare works. But you can see here the blue dots are above the red dots, particularly during the summer and then into the fall. And on the gas consumption, the last few months have been highly problematic. Nobody knows what happened in December, but September, October, November, these are substantial gas increases. There's greenhouse gas emissions attached to those, and it matters. Every greening healthcare member now has, in the last 2 or 3 weeks, has its quarterly savings report that looks just exactly like this for the whole year of 2021. And pretty soon we'll be issuing the first quarter of 2022. Take a time, please, to go look at them, see what they're telling you, give Michael a call and say, help me, what could this have been? What might have happened here? Or even better, let us know. Well, if you know what happened, let us know what it was and so on, because we document that carefully. We keep a file on all of you, and then we've got a better feeling for what's actually happening there. But coming back to this whole idea, we roll up all the hospitals within greening healthcare. We look at the overall trends, the overall pictures. But if the blue dots aren't going below the red dots, it doesn't matter how hard we're trying, doesn't matter what we're doing, we're not making progress. So blue dots have to be below the red dots, especially in Ontario on the thermal energy side. In Alberta, it's both sides of this ledger. These things really, really matter. This is our scorecard. This is your primary scorecard as to how you're doing to feedback on. There's a lot of money in play here. Just when you add up for Ontario and Alberta, and we're just finalizing the Manitoba numbers, the Winnipeg Health Science and the facility, their numbers right now. This adds up to $135 million a year of healthcare spending that's going to pollute the atmosphere instead of going to patient care. You know, and it really is that harsh. It really is that brutal. It's every dollar we waste on utilities is something that's not available to help people be healthy and be well and run a better facility. So there's $135 million just with greening healthcare member facilities. When we extrapolate this to Ontario, to North America, to the world, these numbers are measured in tens of billions of dollars, and it's money that can be, it's money where often it's being wasted and much of it can be saved. So it's a lot of money. So there's an economic driver on top of the environmental one. I just want to close the loop on this part of the discussion around what greening healthcare does, which should be of great value to every member hospital, is we compare you to like hospitals. If you're a mental health hospital, we compare you to the other mental health hospitals. If you're an urban acute care hospital like Mackenzie Vaughan and Humber River and Markham Stouffville, so all of whom we're going to be talking to in just a moment, by comparing yourselves with the better performing of the hospitals out there, we can estimate for you your savings potential, and it's remarkably reliable for making the business case for investing in improvements. So this, for our membership group, there's a couple that we've left off here, but this within the group is the savings potential percentage of every single facility there. And number 55 down there, which is close to 45% total energy savings potential, you know who you are. And if you're not sure, go check your annual report from last year, and when the annual reports come out in the next few weeks this year, take a look at it, because you can save 45% of your energy use. The orange piece is how much of that is thermal energy, either steam or natural gas. That's in Ontario where all the damage is being done on the on the greenhouse gas emissions side. So, 55, if you know who you are, we're going to be in touch, and we're going to be nagging this year or hopefully helping kind of identify what's going on there, and because we need to fix this. These emissions, when they went out in 2021, they're not coming back. If we do better next year, we don't get back what we lost last year. That's gone forever, and it's in the atmosphere, and it's not going anywhere soon. But every one of you has this ranking. Look interestingly at the hospitals at the top that are very close to, obviously, Humber River's right in there, and there are a group of others where all the savings are now in electricity. They dealt with the thermal issue, and they have the model that we are using to show everybody else how they can get their thermal energy and their greenhouse gas emissions under control as well. So the orange is gas, the green is electric. There's much bigger savings potential on the thermal side. So this is if you like, the assessment, the scorecard, the health report that you have on each of your facilities that points you to where the savings are to be found. Your new 2022 annual reports are just coming out. They look just like this. And the tables on the first page of this report tell you where you stand on there. So how do you benchmark against all the hospitals in the database, and where are your savings, and what do they add up to in terms of dollars and greenhouse gas emissions? And on the second page of this, what were your savings like last year? This annual report should be a key part of your strategic planning around facilities and energy and emissions every year. It should be a primary input. It should be something that you're comfortable sharing with the boss and the boss's boss. I'm quite sure in the case of North York General, who are on the call today, their board, who now are looking at sustainability metrics as part of the hospital strategic plan. These are the areas they have a real interest. This is your scorecard. Read it carefully. And the left-hand side of this tells you where to look for your savings. And to remind those who are with the program and those who are new to it, the benchmarking is intriguing because it doesn't look just at total energy use. It also weather normalizes, but it also breaks your billing energy into components. So base electricity is separated out from cooling electricity. And I'll show you overall how that looks in just a moment. So we're actually benchmarking your cooling electricity against every other hospital just like you. So even if your total electricity isn't too bad, you may have an opportunity within the cooling electricity component. And you can see how it's broken out. It's just mathematical, it's linear regression, it's not complicated. But you have a kilowatt hour per square foot metric for cooling electricity, and it's been compared to all the other hospitals just like you. And if it's higher than it should be, this is telling you which systems you should look at. So it's around the cooling plant, it's around air conditioning, it's around, as Jason was mentioning earlier, excessive outside air. All those things show up in your cooling electricities. Even back in the day, the cooling tower fan that was running backwards and had been from the day the hospital was open 20 years earlier. And nobody understood why the cooling electricity was so high. Base electricity relates to primarily to fans. It's the biggest user, but also to lighting, also to medical equipment and so on. So those benchmarks help you narrow down to which systems are we most interested in. On the thermal side, it's the same idea. You can see your base thermal most clearly by looking at just summer gas use. And I'll tell you for a fact that many hospitals today are using 5 times as much, with similar building systems, are using 5 times as much summer gas use as other counterparts there. And it's mostly related to primarily, again, to reheat within the air handling systems, and it comes back simply that we'll look at later, that you're supplying air too cold. You're running the reheat water temperature too hot. They're fairly simple things that can be done that have a dramatic effect on the usage, and we see profile after profile where the summer gas use has been dropped by 70%. You can do this, you will do this. I mean, it's part of the story going forward. But base thermal, the heating thermal is around the extra humidification and heating in the winter to take care of the transmission losses through the envelope, and particularly the heating of outside air volumes, of which you need lots in hospitals. So every scorecard that you get within your annual report has got those 4 components. It evaluates those for you and therefore tells you these are the building systems where your overall opportunity is, where your best opportunities lie. And this is your total opportunity for reducing utility costs, that's your business case, emissions, which is your environmental case. So when the annual report comes, take a moment, it's only 2 pages, please read it carefully, figure out where the priorities are, and give Michael a call and say, let's talk about 2022 and what can we do to do better. Just to quantify this, when we're looking at the total savings potential, that base electricity, so when we had all of the member hospitals together, there's about 55 million kilowatt hours of savings potential for all those hospitals just to become good, not to become great. We're not asking you to become Humber River. We're saying if you can get to the top quartile of older hospitals just like yours, this is what the savings potential is. So base electricity, most of that 55 million kilowatt hours is in fans. A chunk of the rest of it's in lighting, and then there's pumps and all kinds of other things in there. It represents 10% of your base, of the total across all the members' electricity consumption. The cooling electric is so much bigger as a percentage, so there's lots of potential for improvement in cooling electricity. It's just a smaller piece of the whole pie for the year. So we got 20 million kilowatt hours a year of electricity savings potential. I'm just going to hide this because I can't see the whole thing. So cooling electricity is where the big beast is in terms of percentage reductions, and many of you will see really radical reductions in summer use compared with the rest, and you saw that at Bridgepoint. The biggest percentage opportunity and cubic meters of gas and utility cost opportunity on the gas side is in that base thermal piece. And we looked at the systems before. It's reheat in the air handling systems, it's steam losses, it's the efficiency of the boiler plant under summer load operations. So that's both the biggest percentage and it's the biggest gas savings. By comparison, heating thermal is around 9.1% overall savings across all the hospitals combined, which is about 4 million cubic meters. So these are the numbers that drive us. Here's where most of our greenhouse gas emissions reductions are, and this is how we're designing the programs. We want to really prioritize this. We don't want to let go of anything else on this chart, but this is where the big bucks are. This is where the big emissions reductions are. This is where the big opportunities are. And it's primarily operations, maintenance, and controls that are involved there. And that's what we're going to address with our technical panel in just a moment.